Yo, what up, y'all? It's your boy Rob coming back at you once again with another live stream. So, before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get it cracking. All right. So, you guys know what to do. When you guys watch these videos, make sure you watch them all the way through to the end. If you haven't hit the links at the end of the videos, make sure that you guys do that. Also, make sure that you guys share the video out, and also make sure that you are subscribed to the backup channels and to my other social media. All right. So I had planned on doing another live stream on Blacklight Revelations 2. If you guys aren't subscribed to Blacklight Revelations 2, you might want to go check that channel out. Had planned on doing a live stream about that, but there's just too much stuff coming out about C19 and about monkeypox. So we need to talk about this stuff. You know what I'm saying? Shouts out to my man AB Promotion in the building. What up with it, bro? Good to see you as always. All right. So the media has not been reporting these things properly at all. Shouts out to my man Black Manta. What up with it, bro? And what we're gonna do is we're gonna go through several reports. All right, several reports today. I might not even be able to get to my other streams because of how in depth this is gonna have to be. And I want you guys to be aware of all of the inconsistencies and all of the things that the media is not reporting properly. And as I prove these things to you guys, I want you guys to ask the question, why is nobody being canceled? You guys remember early on when it came to C19, they were very strict about the way information was disseminated and the way that reports were delivered. And if just one thing was off, you would get canceled. So the first thing that we're going to talk about is the idiot in chief, President Joe Biden. Now, is everybody concerned? It's saying here Biden tests positive for COVID again. Will restart isolation despite no new symptoms. Now, here's my question for everybody. What's wrong with this sentence? If there's anybody that knows what's wrong with this sentence, please type it into the chat. But there's something very wrong with this sentence. There's something very wrong with this entire situation. Here's my question for everybody, and I need you guys to answer this question for me in the comment section. After initially testing positive for COVID, how long will you continue to test positive before you test negative? That's the question. Shouts out to my man Carlton Way. Keep that question in mind as we go forward. Biden tests positive for COVID again. Will restart isolation despite no new symptoms. All right. So now let me ask everybody the question. When was the announcement first made that President Biden was positive for COVID? Oh, you can test positive without symptoms. That's what happened to me. The only symptom that I had a symptom. I didn't have symptoms. The only symptom that I had was a fever. We got Maya Wolves in the building. What up with it, Maya? How long after testing positive will you test negative? So the question that I need to answer from you guys for is about how long ago did Biden test positive? Carlton Way says a week ago. Does everybody agree with that? Did Biden test positive a week ago? So now if Biden tested positive a week ago, what is the estimated date of this most recent test? So that would mean that at the least it's been 7 days only, right? Since the initial announcement. So here it says President Joe Biden tested positive once again after consecutive days. Now, they don't say how many of testing negative for the virus, his physician said. Biden is experiencing no new symptoms and continues to feel quite well, Dr. Kevin O'Connor said in a memo shared by the White House. But he will, nevertheless, reiterate strict isolation procedures, the presidential physician wrote. Now, I want you guys to pay very close attention to this first bullet point. President Joe Biden tested positive for COVID-19 once again after consecutive days of testing negative for the virus, his physician said. How many consecutive days was it that he tested negative for? Shouts out to my man Sid. What up with it, bro? How many days? Because this is important. So now here it says Joe Biden on Sunday tested positive for COVID-19 once again after consecutive days of testing negative for the virus, his physician said. So again, what day was it that Joe Biden initially tested positive for COVID? This article was published on July 30th. All right. So what was the first day that Biden announced that he was positive? That's the question. And as you guys come in, please make sure you guys smash that like button. Also, if you guys haven't shared the video out, make sure you guys share the video out. Biden, who is 79, is experiencing no new symptoms and continues to feel quite well, Dr. Kevin O'Connor said in a memo shared by the White House. All right. But he will nevertheless, quote, reinstate strict isolation procedures. Biden, who is fully vaccinated, has received 2 booster shots of the Pfizer BioNTech vaccine, tweeted Saturday afternoon that he was asymptomatic but would isolate for the safety of everyone around me. So now, again, I'm gonna keep asking this question. When did Biden first get tested positive? What was the date? I'm still at work and will be back on the road soon, the president's tweet said. All right. So now here it says O'Connor had previously warned of the potential for a rebound in positive test results, a phenomenon among a small percentage of patients like Biden who use the antiviral medication Paxlovid as part of their treatment. Biden had accordingly increased his testing cadence, both to protect people around him and to assure early detection of any return of viral replication, O'Connor wrote in the latest memo, which was made public on Saturday afternoon. Now, what I want to ask you guys again, July 21st. All right, so exactly 10 days. Shouts out to Carlton Way, and thank you. 10 days. Shouts out to my man AJ. What up with it? Now, what I want you guys to answer for me is when from starting the first positive test, how long after the first positive test can you expect to be consistently negative? Does anybody know that information? That's my question. The president tested negative for COVID on Tuesday, Wednesday, Thursday, and Friday, but tested positive on Saturday morning from an antigen test. This in fact represents rebound positivity, the doctor wrote. Now, here's my question. Does it? Is that true? Is that a true statement? If that's a true statement, give me a thumbs up in the comment section. If it's a false statement, give me a thumbs down in the comment section. My man AJ says that he got the notification from Twitch that I'm live. So if you guys are not subscribed to Twitch, make sure you guys go and subscribe to my Twitch channel. If you're not subscribed to Blacklight Revelations and Blacklight Revelations C19 Report on Facebook, make sure you guys go over there. All right. And also, if you guys could, please make sure that you guys have done that survey in the comment section. Okay. Biden's age puts him at higher risk of getting severely ill from COVID. People over the age of 65 account for more than 81% of the deaths from the virus, which has killed more than 1 million people in the United States alone, according to the Centers for Disease Control and Prevention. The president, look at this, the president first tested positive for COVID on July 21st. All right, so what I need you guys to pay very close attention to is remember that date. Remember the date, July 21st. Okay. Remember today's date is July 31st. That's a total of 10 days. Now, what I'm asking everybody is from the time you test positive, which would have been July 21st, when can you expect to test negative? So what the whole point of me asking that question is, why the media hysteria? He felt mild symptoms, including a dry cough, runny nose, and fatigue, O'Connor said at the time. Biden began working in isolation but returned to the Oval Office 5 days later after testing negative for COVID twice over a 24-hour period. The president has experienced no reemergence of symptoms and continues to feel quite well, O'Connor wrote in Saturday's memo after Biden's, quote, rebound test. Now, here's my question. Why are we calling this a rebound test? And why is nobody saying anything about this? AJ, check out some of my other videos that I've done. I've actually done a video about Joe Rogan on this channel. For real, for real. This being the case, there is no reason to reinitiate treatment at this time, but we will obviously continue close observation. However, given his positive antigen test, he will reiterate strict isolation procedures. As I've stated previously, the president continues to be very specifically conscientious to protect any of the executive residents, White House, Secret Service, and other staff whose duty require any, albeit socially distanced, proximity to him, O'Connor wrote. Okay, so now all of that is great. Remember July 21st, right? And we're making a big media hysteria out of the fact that Biden tests positive again. So again, what I need to ask everybody is, after your initial positive test, how soon can you expect to test negative? That's the question. That's the question, guys. So bearing that in mind, we're going to check out this next article. And this next article is a little bit older. How long can you test positive for COVID-19 following infection? Uh-oh, Richard. Uh-oh, Richard. When it comes to testing, PCR tests are more likely to continue picking up the virus following the infection. Now, remember, what it said was that he did an antigen test. That's what it said about his test. They said his was an antigen. All right. So you guys see this here? Ticket bought in Chicago suburbs wins this Mega Millions. So anyway, let's check this out. Now, they just had something important down here at the bottom of the screen. You guys see what this says here? According to the Centers for Disease Control and Prevention, some people who contract COVID can have detectable virus for up to 3 months. But that doesn't mean that they're contagious. Can you guys see that? If you guys can see that, give me a thumbs up. If you can't see it, give me a thumbs down. It's been 10 days for Biden. It's been 10 days. It's been 10 days. So now you guys saw that, all right? And we're going to check this out. Most people who contract COVID-19 likely won't experience symptoms for more than 2 weeks at most, but could test positive even after that. Why are we going through this hysteria with the president, ladies and gentlemen? Why are we doing that? Why? Most people who contract COVID-19 won't experience symptoms for more than 2 weeks at most, but could test positive even after that. So my question for everybody is, why the hysteria? Anybody got any answers for me? Why the hysteria? According to the Centers for Disease and Control and Prevention, some people who contract COVID-19 can have detectable virus for up to 3 months, but that doesn't mean they're contagious. So why are we acting as if just none of this information is out here? Shouts out to my man DJ Elmo. When it comes to testing, the PCR tests are more likely to continue picking up the virus following the infection. Now, do you guys see this? PCR tests can stay positive for a long time, Chicago Department of Public Health Commissioner Dr. Allison R. Wadey said in March. So now my question is, when it comes to Biden's second positive test, why are we just assuming that it's a rebound positive? Shouts out to Donna and DIY Queen. Those PCR tests are very sensitive. They keep picking up dead virus in your nose, sometimes for weeks, but you can't grow that virus in the lab. You can't spread it, but it can be positive. So there you go. It can be positive. Like, but we literally have all of these news reports going around talking about Biden and his C19 second positive result. It's only been 10 days, and it says that you can continue to be positive for up to 3 months. It says it right here. And they say that they got that information from the CDC. But now the mainstream media is getting no scrutiny for putting out COVID misinformation. Does that make any sense, ladies and gentlemen? If that makes any sense at all, give me a thumbs up. If it doesn't make any sense, give me a thumbs down. See, this is the problem. And we're going to go into more issues with the mainstream media and how they're reporting things. Because there's a lot of issues with the way that monkeypox is being reported as well. There's a lot of issues with how they're reporting monkeypox as well. And in my opinion, the way that monkeypox is being reported is more than likely a huge contributor to why it's spreading so out of control. Because it's spreading out of control. If you guys feel that monkeypox, the spread of it is out of control, give me a thumbs up in the comment section. If you guys don't, you guys feel some other kind of way, then give me a thumbs down and let me know how you feel. So now here it says the CDC notes that tests are best used early in the course of the illness to diagnose COVID-19 and are not authorized by the U.S. Food and Drug Administration to evaluate duration of effectiveness. So now they're not used to evaluate duration of effectiveness, but they based him going back into isolation on a test. On a test. So now here it says for those isolating due to a COVID infection, there is no testing requirement to end isolation. What did it just say about Joe Biden, ladies and gentlemen? It said that Joe Biden decided to go back into isolation based on his positive test. What does this say here? There is no testing requirement to end isolation. For those isolating due to a COVID infection, there is no testing requirement to end isolation. However, the CDC recommends using a rapid antigen test for those who choose to take one. And I do believe that the rapid antigen test is the one that Joe Biden took. So, I mean, we're just debunking this very easily. You know what I'm saying? Shouts out to Mimi. What up with it, Mimi? Real quick, ladies and gentlemen, we got 10 likes and we got 15 people watching. Thank you to all 15 people who are watching, and thank you to everybody who smashed that like button. If you guys have not smashed that like button and shared the video out yet, please help your boy out by making sure that you guys do that. So now here it says, R. Wadey said that guidance is likely related to determining whether someone has an active virus. If you did want to get a test on, please don't get a PCR. Use a rapid antigen test, she said. Why? Because the rapid antigen test is the one that will look to see, do you have a high enough COVID level that you are potentially infectious? Now, a PCR test, remember, can pick up some sort of traces of the virus for a long time, even if that virus is bad, even if it's not potentially transmitting. All right. So now here, it says, what else do you need to know about testing for COVID? According to the CDC, the incubation period for COVID is between 2 and 14 days, though the newest guidance from the agency suggests a quarantine of 5 days for those who are not boosted but eligible or unvaccinated. Those looking to get tested after exposure, look at this, those looking to get tested after exposure should do so 5 days after the exposure or if they begin experiencing symptoms, the CDC recommends. Shouts out to Carla. What up with it, Carla? So again, why the hysteria? Why the hysteria when it comes to this? Oh, Biden has tested positive again, and we have to scurry him off into isolation. Like, that's not even what the CDC says. And it's just okay that they're putting that nonsense out. So I don't think we need to read any more of this because we got a lot of stuff to cover. And I honestly think that that proved that point that I wanted to make. Because the point that I wanted to make is what the hell is all the hysteria about when it comes to Joe Biden? Now, I want to show you guys another article, and this is an old article from NPR. All right. But this article further backs up what I'm saying. See, so like this is the thing, right? When it comes to YouTube, YouTube can do whatever they want to with my channel. They can, shadow ban it. I don't believe in the shadow ban, but they can have the algorithm not recommend my content. It's not gonna stop the accuracy. It's not gonna stop the accuracy. It's been 10 days for Joe Biden. Still testing positive after day 10. How to decide when to end your COVID isolation. So now the question that I have for Joe Biden's presidential doctors is, did they follow the guidelines? Because he's right back in isolation, which means that he was out for some time. Now, again, this is a very recent article here. This is an article from June 30th of 2022. Still testing positive after day 10. So this is something that has been talked about. This is something that we know about. The media counts on people to be stupid. And one thing that I do not want my subscribers to be is unprepared or stupid. So now here it says many Americans have wrestled with this dilemma at some point during the pandemic, yet it still seems to come up again and again. When can you stop isolating after a COVID-19 infection? The question is especially vexing if you're feeling better but still testing positive on a rapid test. Even with the arrival of new subvariants, the basic ground rules haven't changed since Omicron first came to the scene. The Center for Disease and Control Prevention says someone can stop isolating after 5 days if they're fever free for 24 hours and are starting to get better, as long as they keep wearing a mask around others for another 5 days. It said that Joe Biden was asymptomatic, which means that he doesn't have a fever. It said that Joe Biden was asymptomatic, which means that he doesn't have a fever. So why is he scurrying back into isolation is the question. He's also vaccinated and boosted. So now here it says some researchers have criticized these rules, pointing to research that shows some people may remain infectious after day 5. And many experts advise waiting until you test negative on an at-home test before venturing out. So now let's just say he does still have an active infection. He didn't use the same test. He used an antigen test. Shouts out to my man Ulaw. What up with it, bro? But if you feel fine, it can be frustrating to wait, especially if you're in the subset of those who test positive past 10 days. So, again, this is a situation that they already have literature about. This isn't a new situation. This isn't something experimental. This is something that we know about. So now here it says James Hay, who studies infectious disease dynamics, remembers earlier this year when his sister continued testing positive for 2 weeks. The family had plans to get together over the holiday, gathering that included an older relative who was vulnerable to COVID. To us, that was just not worth the risk, says Hay, who's a research fellow at Harvard T.H. Chan School of Public Health. Going to the shops with a mask on, that's a different kind of risk consideration. Okay. Testing to get out of isolation is tempting because it promises a straightforward answer. Unfortunately, and perhaps unsurprisingly, the science is not entirely settled. The science is not entirely settled. There it is. So now my question is, if the science is not entirely settled, then why are we out here acting like it is? Why are we out here making rules based on science that's that hasn't been settled? Why are we doing that? I thought they said trust the science. These are the very people that said trust the science. I thought that's what they said. So now here it says we don't have anything that says definitively you are contagious or definitely you're not, says Dr. Emily Landon, an infectious disease specialist at U Chicago Medicine. The best thing we have are these rapid antigen tests, which is what Joe Biden took. So now basically what we have is people criticizing people for conspiracy theories while other people at the same time are also going off of evidence that has not been fully decided yet. Facts, DIY Queen. Big facts. Unlike PCR tests, which search for genetic material from the virus, rapid antigen tests work by looking for proteins that are packed inside the virus. A positive test generally correlates with the presence of infectious virus. Scientists can determine that by taking samples from someone who's been infected and trying to grow the virus in a lab, what's known as a culture. So now this is the reason why they decided to put Joe Biden back into isolation, because remember, he took that antigen test. So what they're saying here is that a positive test with the antigen test generally correlates with the presence of infectious virus, but that's only a general correlation. It's not a definitive thing. Remember, the science is still up for debate, according to this article. So now here it says generally most people who get infected are not still testing positive on an antigen test 10 days after symptom onset. Now, if this is the case, Joe Biden didn't even wait his 10 days because he announced July 21st. It just turned July 31st. So he didn't even wait the full 10 days. So now here it says if you have enough virus in your system to be turning one of these tests positive, that means your body probably hasn't yet fully cleared the infection, says Hay. But there is no perfect study that shows how likely it is that a positive test on a rapid test translates into shedding enough virus that you could actually infect another person, says Dr. Jeffrey Baird, the chair of Department of Laboratory Medicine and Pathology at the University of Washington School of Medicine. So there it is. Literally what I've been saying. It's not definitive. It's not definitive. Just like what we said from the jump. So now here it says the answer to that is clear as mud, he says. Indeed, infectious disease experts tend to differ about how much stock to put in a rapid test when someone knows they're infected and deciding whether it's safe to rejoin the outside world. After all, Baird points out that these tests, look at this. After all, Baird points out that these tests were never designed to function as get out of isolation cards. Relying on the result to tell you whether you're truly still infectious is dicey, he said. There you go. There you go. There's actually a lot more discrepancy than anyone would be happy with, he said. Here we go. Now, remember, we're talking about the antigen tests. A positive antigen test essentially could be picking up leftover viral garbage, which can include dead viruses, mangled viruses, viruses that are 90% packed together but not really going to work. And the amount can vary depending on each person's immune system, the variants, stage of infection, and so on. So, again, it's interesting that they're basing this on this antigen test. And the thing is YouTube can hate as much as they want to on the video, but we literally just read this out of an article. We literally just read this out of an article. So my question is, what does that say? What does that show? What does that say and what does that show? So now here it says this is partly why Baird did not bother to take a rapid test when he had COVID and had decided when it was okay to return to work. After a week, when he was feeling better, he came to the office where everyone's required to wear an N95. Even if it's an imperfect tool, not everyone is down on using a rapid antigen test. Landon says it's extra information that can give you a sense of how to proceed, especially if people are banking on the CDC guidance to determine whether to end isolation. That's because some people will still be infectious after 5 days, she said. In fact, a study co-authored by Landon followed healthcare workers at the University of Chicago who had been infected but were feeling mostly better and went to get tested after 5 days. They found that more than half of them still tested positive on the antigen test after 6 days. So there's that. There's that. So this is not uncommon. Is basically my point. This is what I'm trying to tell people. What they're overblowing in the media with Joe Biden and his situation that he has going on, this is not uncommon. This is something that you see happen all the time. Clearly, what these studies are saying. Shouts out to Val. This tracks with other research. For example, one study analyzing data from a testing site in San Francisco during the January Omicron surge suggests that many people were still testing positive after 5 days. And research done by the CDC shows about half the people were still testing positive on the antigen test between 5 and 9 days after symptom onset or diagnosis. It's been 10 days for Joe Biden. So now why the special media attention? That's the question that I have for everybody. Why the special media attention that Joe Biden is getting? So now here it says you'd be erring on the side of caution if you followed the test and said, I'm not going to leave my isolation until after my test is negative, she said. So see, this is what she's saying. I'm not going to leave my isolation until after my test is negative. So that school of thought apparently is the school of thought that Joe Biden's doctor is using. The presidential doctor. Preliminary data from scientists at Harvard and MIT show that about 25% of symptomatic people with COVID-19 had virus that could be cultured after 8 days after symptom onset or their first test. So again, we're dealing with after 8 days, which is probably about the time when Joe Biden took his second test that they're talking about that's positive. Okay. But Hay cautions that there is considerable variation in the studies because of small sample sizes, differing populations, and how the rapid tests are done, the vaccination status of who's being tested and how healthy they are, among other factors. So now here's my question. How healthy do you guys think that Joe Biden is? How healthy do you guys think Biden is? You guys think Biden is pretty healthy, or do you think he's not very healthy? What do you guys think? So now here it says that explains a lot of the variation across studies, but I think it's still pretty consistent as an overall finding that if you're antigen positive, then you'll quite likely be infectious, he said. Some research has aligned more closely with the CDC isolation guidance, which assumes most people will no longer be infectious after 5 days. All right, so that's what the CDC recommends. So I find it fascinating how they promote some recommendations of the CDC versus others. What's up with that? Does that make any sense? So now here it says a preprint study of close to 100 vaccinated college students at Boston University suggests that a majority were no longer infectious after 5 days. All right. So now again, we could read more of this article, but I think that we've made our point. The media hysteria that's going on as far as Joe Biden goes, in my opinion, is unwarranted as well as unnecessary. So we're done with talking about C19. So now we can move into monkeypox. And I don't know if anybody is aware, but monkeypox has been declared a public health emergency in New York City. Now, remember, we talked about these public health emergency declarations yesterday. We talked about how San Francisco declared it a public health emergency, and we talked about how New York State declared it a public health emergency. But here we go. Monkeypox declared a public health emergency in New York City. What do you guys think about that? I'm not sure how many cases there are worldwide, Sid. I don't think there's as many as coronavirus. They're saying that the Biden administration is expected to consider monkeypox a national emergency. It hasn't happened yet, but that's what people are expecting. So let's check this video out.
Well, now to the latest on the monkeypox outbreak. Governor Kathy Hochul has declared a disaster emergency in New York State as officials try to stop the spread of the virus here. The move allows the state to speed up its response to the outbreak and allows healthcare professionals to take additional steps that will help get more New Yorkers vaccinated. Right now, there are more than 1,200 confirmed cases in New York City, and that number is rising. Some local leaders say we are far behind when it comes to responding to this outbreak.
Far behind when it comes to responding to the outbreak. Now, my question for you guys is, did it have to be that way? Did it have to be that way, or could this have been prevented? Listen to this.
Vaccinated. Right now, there are more than 1,200 confirmed cases in New York City, and that number is rising. Some local leaders say we are far behind when it comes to responding to this outbreak.
We don't have enough testing. We don't have enough access to treatments. We just certainly don't have enough supply of vaccines. It's a repeat of some of the.
Now, how do we not have enough supply for vaccines? Remember at the beginning of this thing, they were bragging about all of the smallpox vaccine that they had stocked and the fact that they had that new vaccine. Now, all of a sudden, we don't have enough. Now, all of a sudden, we don't have enough. Listen to this.
We don't have enough testing. We don't have enough access to treatments. We just certainly don't have enough supply of vaccines. It's a repeat of some of the painful mistakes that were made in the early days of COVID. It's really disappointing that 2 years later, still, in the face of a different infectious disease, we're repeating some of these same mistakes.
New York State is slated to receive 110,000 additional vaccines from the federal government, but it will take, we are told, 4 to 6 weeks for that shipment to arrive.
So now here's another question. Why the logistics backups? And you guys see this up next. Mr. Beast becomes one of few YouTubers to surpass 100 million subscribers. What do you guys think about that? I don't think there's any black YouTubers that have anywhere near 100 million subscribers. But Mr. Beast and PewDiePie are over 100 million. So everybody should rest easy with that at night.
It's all about the deal at Brunswick Auto Mart. Save big this month with deals like
Here
this.
we go with this nonsense.
Don't miss the Make This the Summer event. And Lisa 2022 Ram 1500 Bighorn Quad Cab Night Edition 4x4 with 20-inch blackout wheels for just $375 a month. Or Lisa 2022 Ram 1500 Laramie.
I mean, you can't even stop this.
$397 a month. Brunswick Auto Mart. Car buying made truly simple.
Okay.
You can't even stop that. You know what I mean? Like that's crazy. Yeah, Mr. Beast becomes one of few YouTubers to surpass 100 million subscribers. Mr. Beast, I dare you to talk about reparations. His following would drop to zero. Yeah, he'll probably talk about reparations, but not in the way that it'd be, easy on our ears. You know what I'm saying? Nobody's gonna talk about. We can't even get black people to talk about it like that, let alone, a white person. That's what I find that just to me it's just hilarious. We can't even get black people to talk about reparations properly. And we have an expectation that anybody else is going to either give a shit or care. Like, people got to get in touch with reality. Seriously. Seriously. Carlton, you about to cause a shootout. Because it'd be whole groups of black people fighting over how to tell Mr. Beast how to talk about reparations, and it'll just never get talked about. Shout out to my man Fantizzi. What up with it, bro? You know what I'm saying? New York City officials declared monkeypox a health emergency in the Big Apple. They should say in the Adam's apple. Saying that it's the epicenter of the outbreak. So there you go. It's the epicenter. Over the past few weeks, we have moved as quickly as possible to expand outreach and access to vaccines and treatment to keep people safe. This is what Mayor Eric Adams, who invited a lot of LGBTQ people to New York, and Health Commissioner Dr. Ashwin Vasan said in a statement on Saturday. The declaration will allow the health department to take unspecified measures to help stop the spread of the illness. So again, they continue to show black people. That's why I titled this, I think I said European monkeypox, because it is European monkeypox. That's what's up, bro. Shoot that shit to me. Adams and Vassan said they were working to obtain more vaccine doses, saying some 150,000 New Yorkers may be at risk. Now, here's my question, and I need you guys to answer this in the comment section. Who are these 150,000 New Yorkers that may be at risk? It needs to be clear what New Yorkers might be at risk. People who have a traditional family structure, that are living with in a relationship where everybody's practicing fidelity. Shout out to my man Keith Weston. What up with it? City officials have warned that gay and bisexual men who have multiple or anonymous sex partners are at high risk of exposure. They're at the highest risk of exposure. They're at that group is at the highest risk of exposure. If you guys agree that that particular group is at the apex of exposure, give me a thumbs up in the comment section. If that's not correct and I'm wrong, then please correct me in the comment section. Ladies and gentlemen, real quick, we got 15 live viewers. Shouts out to everybody that's watching. And we got 13 likes. If everybody smashes that like button, we'll be at 28 likes. Remember, we got a goal of 100 likes a stream. So please make sure you guys smash the like button, share the video out, tell your friends. So now here it says Governor Kathy Hochul on Friday night declared the disease an outbreak, a state disaster emergency with nearly 1,400 cases. Also known as the orthopox virus, the illness can be transmitted through bodily fluids or close bodily contact with the pus-filled lesions of a patient, as well as contact with respiratory secretions, according to the CDC. Symptoms usually clear up in a matter of weeks. All right. So now here's my question for you guys. Where do you guys think the next place will be that they declare an emergency when it comes to monkeypox? Where will the next monkeypox emergency be declared? What do you guys think? You guys got any answers? Drop your answers in the comment section about where you guys think the next monkeypox emergency will be declared. What state will it be in? So now, this article I found interesting because there's a lot of interesting things about this. It says political correctness helped turn monkeypox into a global emergency. Now, here's my question. Which element of political correctness, the one involving not talking about the LGBTQ community or the one not talking about Europeans? San Francisco has already been declared in a state of emergency. Bloop, bloop. I'm surprised you guys. Yeah, I had to go with DJ Elmo. I was about to say, I'm surprised you guys ain't saying Atlanta. I'm surprised Atlanta's not the popular choice. You know what I'm saying? Political correctness helped turn monkeypox into a global emergency. Now, that article was written, as you guys can see there, that article was written on July 30th of 2022. Now, here's my question. How long have we been saying that them not talking about this accurately is going to lead to more damage? How long have we been saying it? They keep hiding things. They keep not talking about things properly. They keep leaving things out. How long have we said that? We said that off the rip. Is it Fantizzy's birthday? Everybody drop some birthday emoji in the chat for Fantizzy. Shouts out to my man Fantizzy. Happy born day. You know what I'm saying? Now, we've been talking about this. Since day one. Exactly, Donna. So now what they're going to do here, this is an article by some guy named David Kaufman. We're going to spin this into the political correctness about discussing it in terms of the LGBTQ community, but he's going to leave the European part off. Facts, Val. Said it from the beginning. Sidestepping these issues. Shout out to my man Bronze of God. What up with it, bro? Sidestepping these issues to protect certain people. And now those very people that were supposed to be protected are the ones suffering the most. So now here it says, in late May, Condé Nast LGBTQ site Them Us went out of its way to distance a nasal viral scourge known as monkeypox, the main demographic who was catching it, gay men. The piece headlined, "The monkeypox virus is affecting queer men, but has nothing to do with being queer." Now, the thing is that's the same thing that the mainstream media was saying. That's the same thing that the media was saying. Now, my thing is, what I said was, it's the activities that LGBTQ people are doing. And when it comes to the LGBTQ activities, I'm talking about shit like this. I'm not talking about a LGBTQ couple that lives like a normal couple and has a relationship where no one is cheating or stepping out. In my opinion, those kind of couples probably have the same risk level as everybody else. It's these people who are engaged in this. Early monkeypox cases spread through close contact at circuit parties attended by gay men. But some media outlets worried about homophobia shied away from reporting the full truth. Circuit parties. Now, this isn't even true because these are European circuit parties. Like Carlton said, these are those these are those in the beginning of Blade parties. So we're going to leave off the European part and we're going to leave off the LGBTQ part. And somehow, after omitting data, we think that we're going to get accurate messages disseminated for prevention. How's that work? Now, they need to be telling people practice abstinence, practice fidelity, and inspect your partner for lesions or test before intimacy. It's not that damn hard. And that has nothing, there's no one that should feel attacked by saying that. Bad Boy 2 parties, yeah. So now my thing is, I'm sitting here telling you responsible LGBTQ couples who operate, where they're not stepping out on each other, they're checking their health. Those kind of people, in my opinion, probably have about the same risk level as a regular heterosexual couple. It's the people that go to these slosh parties and do all of this just all over the place, this sardine box action. These are the people that are going to get it. And the reason why is because the behavior, the risk-taking propensity is higher. They don't care who they're laying with. They don't care about fidelity. They don't care about integrity with their partners. They're just doing whoever, wherever, sticking it in whatever hole they can find and not washing it off in between. Okay? Well, that's not practicing hygiene, for one. And for two, we already know there's a whole host of STDs that people can get from the exact same behavior. And those kind of STDs are not specific to heterosexual or LGBTQ. It comes from hygiene and practice. These people are participating in boy-on-boy swinging parties. That's going to cause diseases. That's going to cause problems. And not because it's boy-on-boy, because of the damn behavior and because of the risk-taking and because of not vetting a partner and because of infidelity. Yeah, facts, Carlton. These people are LGBTQ pookies. So now, how is that being anti-LGBTQ when you're sitting here saying people who participate in a normal LGBTQ relationship that are faithful, don't step out on each other, and practice hygiene and check and test? Because heterosexual people HIV test all the time. So that's not a requirement that is extenuating. So why would anybody assume that that would be something that will hurt somebody's feelings? I bet you they mad now because they said that those anal genital lesions are extremely painful. Talking about being butthurt, motherfuckers, now y'all butthurt for real, and nobody even said anything. But now y'all are actually experiencing pathological butthurt. The very thing that y'all was trying to avoid, being butthurt by names, now y'all for real are butthurt by the disease. And honestly, that's not even as far as I would have went. I would have recommended a travel ban from Europe. And I don't know, like, see, when it came to C19 and all this other stuff, when it came to C19, they were quick to recommend travel bans. They were quick to say when the Omicron variant came out that people from South Africa, even though it didn't originate in South Africa, the new data came out and said that it had originated in the Netherlands. They quickly banned South African travel. It hasn't even been talked about. It hasn't even been discussed. Hasn't even been brought up to travel ban Europe. Why? That's the question, ladies and gentlemen. Why? Does that make any sense? London is one of the epicenters. They need to ban travel from London. And they need to actually, the United States needs to go ahead and do this. They need to monitor the travel from New York City and from San Francisco. They don't need to be letting people from New York and San Francisco travel to other parts of the world right now. They did that with C19. So now my question is, why are they not doing things with this that they were doing with C19? That's the question. Real quick, ladies and gentlemen, we got 15 live viewers. Shouts out to all 15 people that are watching. If you guys could please smash that like button, it would get us to 33 likes, which would be awesome. Remember, we got that goal of 100. And also, if you guys haven't shared the video out, please make sure that you guys share the video. And if you're not subscribed, go ahead and hit that bell icon. All right. They can't let Europe look bad. It's already looking bad. It's burning up. It's on fire. Literally, people dying from heat waves. You know what I'm saying? So now here, look at this. The piece headlined, "The monkeypox virus is affecting queer men, but has nothing to do with being queer." It stated that while a large fraction of those infected in the current global outbreak identify as gay or bisexual men, there is no correlation between the identity and their illness. This is a bunch of bullshit. And we just looked at a bunch of charts and graphs yesterday that said otherwise. Yet, no cancellation. They're not canceled for saying that. Why? How? Why are they not canceled for saying that? How does that work? How do you not get canceled for spreading misinformation about a disease that a bunch of world governments have considered a global emergency? How does that work? Does anybody know how that works? How does that work? Make it make sense. So now here it says blaming the gay community or gay behavior, it concluded, is not sound public health. Nobody's blaming the gay community. So now if somebody is more susceptible to a disease, that's blaming them. So if you say this group is at risk, that's blaming them. Since when? Since when and how is that blaming them? How's that work? That's called warning somebody. That's not called blaming. That's called warning. Hey, I noticed. What if there was a, you remember what's the name of that song that Snoop Dogg and Dr. Dre made? G Thing. Remember that? They said it was a getting funky like an old batch of collard greens. What if the stores had a whole bunch of old batches of collard greens and people was getting sick? Okay, you know what I'm saying? Black people, you know what I'm saying? Brothers and sisters, especially FBA people. Most of us enjoy collard greens. We could be experiencing some stomach issues because of these bad collard greens that have been in the stores. That's not blaming. Like, that's not black people's faults that they're getting stomach aches from eating collard greens. It's the customers who purchase collard greens and are most likely to eat them are black, so you're warning that community. So how is it that, okay, you know what I'm saying, if you go to these man-on-man brothels and, you know, fish out of water parties, you might mess around and get sick. You might wake up in the morning looking like 101 Dalmatians one day. I mean, they warn people who have sex about STDs. Is that blaming people that have sex for STDs? No. That's warning them. If you engage in these activities, this is what you run the risk of. Someone could get pregnant. Someone could get a disease. It's not blaming anybody for anything. Nobody's blaming Denmark for the disease getting out. Nobody's blaming Europeans for allowing these infected people to travel all over the place. So clearly that's not something that's been done throughout this entire thing, is blame. So now here it says, last World Health Organization declared monkeypox a full-scale global emergency as the disease has spread rapidly in just 3 months. In late May, 100 people reportedly had the virus. Now there are more than 18,000 cases worldwide, with nearly 4,000 in the U.S. alone, according to the CDC. New York is now also calling monkeypox an imminent threat. And as you guys know, most recently, New York City called it a public health emergency. It is true that gay men are not responsible for the monkeypox outbreak, like HIV or C19 viruses can't target specific communities. But those, what? So here it says, like HIV or C19 viruses can't target specific communities. That's interesting. Viruses always target specific communities. They target the people that are susceptible to them, which makes a community. So what are they talking about? Like if you live in filth and a virus is inside of the saliva of bed bugs, that community is targeted. Anybody that has to live in filth for whatever reason. If you have a ethnic practice that's dirty, or if you are poor, your community is targeted. So now here it says, but those early monkeypox cases were nearly all contracted at large scale circuit parties across Europe, which are almost exclusively frequented by gay men. So again, this is a behavior, it's a pattern behavior, and it's a specific ethnicity and community. Which, I don't understand why we're not calling this European monkeypox. They called this, C19 and, you know what I'm saying? All of this. It's crazy. Here it is. Look again. Like HIV. I like how they did this too. They just casually throw in that it came across Europe with no suggestion whatsoever to initiate a European travel ban. So we're gonna sit here and talk about the political correctness that we're using against the LGBTQ community, but we're not gonna talk about the white protection that's being given when talking about this topic. The white protection. Europe. This stuff is coming out of Europe because of European people engaging in degenerate behavior at degenerate parties. And when I say degenerate, let's not get it twisted. I'm not talking about their gender. I'm talking about sloshing around, engaging in infidelity and not telling their partners and having multiple sex partners. That's what I'm talking about. I'm not talking about the fact that they're LGBTQ. Despite the fact that I don't choose that lifestyle, I'm not talking about you being LGBTQ. I guarantee you that if heterosexual people were going to these circuit parties and doing all kind of crazy shit, they would be getting the shit too. When it comes to porn and different things like that, they screen those people. What is the screening like at these circuit parties? A lot of brothels and escort services, they screen the women. What's the screening like here? Somebody gonna mess around and replace the M with a H and start calling it that kind of pox. That's what somebody gonna do. Somebody might just start doing that. You know what I'm saying? So now here they say it's not a stigma, it's simply a fact. So again, which part is the stigma? We talking about the fact that they're LGBTQ or the fact that they're practicing things that are exclusive to Europe in Europe and it's European people doing it? Like what are we talking about here? But we're not talking about it in terms of that. We gotta keep talking about monkeypox is endemic in Africa. That's what they're gonna do, Donna. Somebody gonna do it. Now, if they did it, would they be wrong? So now here it says also, sex wasn't the main mode of transmission. Close physical contact was. Monkeypox is spread through skin-to-skin contact. The type of close physical contact that occurs at parties where groups of men, look at this, often half-dressed, dance in proximity. Oh. I don't even like going to clubs and everybody's all funky and sweaty and pushing all up on everybody. It's all crowded and hot in there. You know what I'm saying? You're trying to move around and somebody, you get pushed, and next thing you know, your face is in somebody's back and the shirt is all damp, and you want to just go to the bathroom sink and just light your damn face on fire because you just feel disgusting. Oh. Ugh. Look at this. Look at this. Unsurprisingly, circuit parties were also early C19 super spreader events. Nobody said anything about that. So now look at this. Look at this. The unwillingness of woke media and nervous health authorities to make this link clear is a disgrace. Woke media. Now, what do reparations and black people have to do with this? Because when we talk about woke, we're not gonna adopt the mayonnaise version of the word. We're going to talk about it in terms of the real definition of the word. That's facts. Super facts. YouTube has tried to destroy this channel. Rob has been doing nothing but reading and deconstructing articles and has been spot on. YouTube needs to try to help this channel grow. Rob is doing a public service. Facts. And you-law knows, because they used to give me strike after strike after strike after strike on this channel, and I peeled them all and won. Literally, I would post a video, within minutes it would be struck down. And I used to and every time my videos would get struck down, I would make a video about why the video shouldn't get struck down, and then they would put it back up. If you guys binge watch and check out some of my older content, you will see that. You-law is not lying. So now here it says headlines such as this one from Condé Nast LGBTQ site them.us worked overtime to distance monkeypox from gay men, even though they were the main risk group from the beginning of the outbreak. And I mean, this is another thing, right? There is in my opinion, responsibility that people have of doing independent research and understanding the dynamics of a lot of things. And my thing is that if people had followed up on this and people had paid attention to this and people were watching this from the beginning, they would have known exactly what path this was going to take, because we all did. We all knew, and we all said it, and we were all right. And like I always joke around about, but I'm not really joking. I'm dead serious, and I always say this. And I directed comment to Carla and Val. This right here is another justification and another reason why we need to have our own think tanks. We need to have our own think tanks. People may get mad at me for saying this, but quote unquote, a quote, new black media is not enough. It's not enough. There needs to be medical information from a black perspective, healthcare information from a black perspective, real estate, education. You cannot count on the information that any of these other outlets put out because it's not honest. And it's definitely not geared for anything to benefit any of us. And that's one of the reasons why I created this channel, because I knew exactly what they would do with all of these diseases. If you guys watch the videos from the beginning, from the early first, when this channel first started, it's exactly what we talked about. And as you can see, they're doing that. And I agree, we need to start a think tank. We had to get some scholars. People need to produce academic journals, do research, and then that information needs to be fed to a political machine. This is stuff that people should have been doing decades ago. These politicians are completely disconnected. Now, if you listen to any other media, they're not going to tell you things about monkeypox or C19 like you'll get here. But you guys notice my channel is still running strong. Yeah, see, Mimi? Now, if you watch the old videos, you will see that the information from the older videos, it is not stuff that they were talking about from the beginning of either one of these pandemics. Think tanks are absolutely important. They organize information and help to create objectives using that information. It's like a navigation vehicle for information. And Val and Carla always bring up Dr. Claude Anderson, which is true. He's got that Harvest Institute. That's a great start for a think tank. Reading those Powernomics books, and what is that book called? Black Labor, White Wealth. And Neely Fuller Jr.'s got that Universal Code book. All of those are good books. But the end goal of all of that information being put together and organized should be us getting our objectives that we need to get done by any means, even if it requires force. Otherwise, we're going to be subject to nonsense. There should be doctors that have a black agenda. You know what I'm saying? Like, finance and economics is not enough. There should be a group of B1 doctors that are looking to increase black life expectancies, decrease comorbidities, all of that stuff. It cannot just be media. And that's why when I say, okay, I hear people talking about no tangibles, no vote. What are we going to be doing while not voting? In my opinion, these are some of the things that can be done while not voting. Because once these think tanks get put into place, then people will know exactly what it is that they need to be looking at as far as exactly how to get things done and how to navigate a vote. The live stream that I had planned for today, before I decided to do this one about monkeypox, it was about money. It was about a ton of money that these governments plan on giving out while sitting there telling us they don't have any. Tons of money. Even in New York. Mayor Eric Adams just teamed up with somebody named Lander to unlock $4.2 billion. California just got, what is this? How much money did California get? Let me see real quick. California just got $631 million to bolster infrastructure change for climate. Thought they didn't have any money. They got plenty of money. Duke has a black. You talking about Duke from 2 Live Crew? Bronze, is that who you talking about? He got a think tank. What they be thinking about? What they be thinking about? Yeah, think tanks are crucial in my opinion. Think about Vladimir Putin. You guys think that he has a think tank? Oh, Duke University. I thought you were talking about Duke from 2 Live Crew. What do Duke University be thinking about? Matter of fact, I haven't even had a chance to get to that Harvard University stream. That Harvard University stream is going to be about as shocking as that Canada stream. So you guys are going to definitely want to see that one. So now here it says, even though the majority of cases back in May were already connected to the gay male social venues. So you see, and then pay very close attention there, leaving out Europe. Most media outlets not only refused to acknowledge it, they said doing so would encourage discrimination. Charities warn against stigmatization of gay and bisexual groups amid outbreak, declared the Independent. Could monkeypox bring a new wave of homophobia, pondered Slate. Blaming gay men for monkeypox will harm everyone, Scientific America foreboded. Now, again, nobody was blaming LGBTQ people for monkeypox. Shout out to my man Cameron. What up with it, bro? Giving the facts is not blaming. Yeah, exactly, Cameron. It's harming gay men. It's causing them harm. We know that gay men didn't construct the disease. Well, they may have. Who knows? That's not something we have evidence of, though. You know what I'm saying? Even the UN weighed in on the political monkeypox blame game, stating in a May 22 release that Joint United Nations program on HIV/AIDS was concerned that some media reporting and commentary was reinforcing homophobic and racist stereotypes. Racist stereotypes against who? White people? Racist stereotypes? This is what these people so damn crazy. They they really believe that they have brainwashed the entire world. They truly believe that. Well, you know, these people might think this is racist. Why would anybody think anything racist when this is going on in European slosh bars? I mean, unless you're trying to say that people who criticize white people or Europeans are racist, which again, I mean, I don't know how you consider that racist when the evidence says that this is coming from Europe, coming from London. 75% of the cases are white men. See, that's that projection. That's white people acting as if everybody else operates the same way that they do. we never came up with a global smear campaign to say that white people are dirty. I mean, that's kind of what they presented. You know what I'm saying? And people have historic accounts of that, but nobody's just going around saying that. So why would racism be a part of monkeypox? That's some media reporting and commentary, and it was reinforcing homophobic and racist stereotypes. What racist stereotypes? The fact that it's gay white men? That's a racist stereotype? DIY Queen says that LGBTQ is being moved into a racial class legally. Check out the latest DOD bill. I told you guys. Now watch. That's going to be, just wait 20 years. If I'm still alive and healthy and my channels are still existent, that'll be the big I told you so. The up and coming trick bag for the next halt on reparations is you will soon be the race that you were assigned at birth. It'll soon be the race assigned at birth. Mark my words. You know how now they're trying to do this thing with gender being assigned at birth? It'll be the race you're assigned at birth. Maya says, I think they're just butthurt, especially if they're infected. They said it's some of the most severe ass pain that they've ever experienced. Instead of being, but I guarantee you, feelings hurt is a lot worse than a blistering ass. You know what I'm saying? I would much rather have my feelings hurt than have a bloody, runny anus. You know what I'm saying? But that's what's going on. That's what's going on. I bet you them asses feel like how these damn things on here look. And these don't look comfortable at all. These do not look comfortable at all. These look like a bunch of kiwi fruit. So this is a close-up of the monkeypox virus, which has now infected nearly 20,000 people worldwide, including 4,700 cases in the United States, though rarely fatal. And we'll talk about some deaths because some people have died. The disease causes fever and painful lesions. Look at that. Those look like they cause painful lesions. Them look like some damn pin cushions, and they're in people's butts. Yeah, I wouldn't want to be sitting on those. I wouldn't. Who would want to sit on that? Not me. No, sir. So now here it says, few things are more predictable than progressives blaming. Look at this. Few things are more predictable than progressives blaming racism and homophobia for a public ill. But the monkeypox outbreak takes this to confounding new levels. Here we go. Just as with other, quote, woke obsessions, such as gun violence or the transgender debate, which none of that has anything to do with black people. So why are white people calling that woke? Why are white people calling that woke and not calling monkeypox European? Can somebody explain that to me, please? Is there anybody that can explain that to me and help it make sense? Help me make some sense of it. Real quick, ladies and gentlemen, we got 16 people watching. Shouts out to all 16 people who are watching. If everybody smashes that like button, we will have 39 likes. So please help your boy out by smashing that like button. Also, if you're not subscribed to the channel, take a moment, hit that bell icon twice. All right. The instance on placing politics above data and science has led to confused messaging and very few solutions. Yeah. Again, why hasn't a European travel ban been suggested? Facts, man. What up with it, by the way, bro? There we go. Very simple. See, Keith Weston, MD. Keith Weston, medical doctor, says, calm down on the orgies, wash your ass. That's my point. Now show your insurance card to my secretary, and I'll see you again in 30 days. Keith Weston, MD, ladies and gentlemen. You know what I'm saying? Probably look like a baboon's ass. I wouldn't doubt it. That's probably what people's throats look like, for real, for real. Remember how they said people had those sore throats and lesions all inside their throats? I bet you when they open up their mouth and stick a thermometer down there, it looks like a baboon's ass inside of somebody's mouth if they got monkeypox. Oh, man. Yeah. If you guys haven't watched the stream that I did yesterday about this, make sure you watch it. Watch it all the way through to the end. Because this part right here that Maine is talking about, that'll give you a new perspective on a lot of things. Let me just put it like that. So now here it says, now, ironically, LGBTQ leaders are singing a different tune. As hundreds of cases course through New York City and other metropolises, with virtually all of them detected in gay men, suddenly, not only is monkeypox a queer disease, community leaders are blasting local health departments for failing to adequately treat the LGBTQ community. Remember, I said that. We talked about that yesterday. Public health failure is how out California State Senator Scott Weiner and Assembly Member Matt Haney described the federal government's response this month. See? We talked about that yesterday when we read that article from the Sacramento Bee. Did you know about that before, Maine? Or is that the first time you ever heard about that? They had a whole issue going on in Brooklyn, New York as a result of that. Crazy. So now here it says even the lack of sufficient monkeypox vaccines, along with a bungled vaccination rollout across the United States, was down to, you guessed it, homophobia, according to the Los Angeles Times headline last week, along with collective indifference that stems from the disease largely hitting the LGBTQ community. Now, again, all they had to do was listen to my channel, and they'd have known exactly what time it was. They would have known. You know what I'm saying? They'd have straight up known. As a gay man of a certain age, this sounds all too familiar. Nearly 4 decades ago, during the earliest days of the AIDS epidemic, doctors in the LGBTQ communities like Larry Kramer urged gay men to embrace, look at this, urged gay men to embrace safer sex practices. Once it became clear that LGBTQ was contracted through sexual contact. Isn't that what I've been saying from the jump? Practice safe damn sex. You don't need to wrap your entire body in a condom when you go under blankets. Why they keep talking about you can get this shit from sheets. Yeah, you can get it from infected bedding. Like, shut the man. They keep playing. These numbers are going to keep getting higher. He said he wasn't going to a zoo anytime soon. You should have asked him, did he have any white people in his family? Because it started in Europe. Oh, I bet you it fell right off on the floor. You should have kicked him right in his ass when he tried to pick it up and say, if you catch monkeypox, this is how it's gonna feel, and then kick him right in his ass when he bent over to pick it up. This is how monkeypox feels. So now you heard it on the video, and now you got a little sample. Don't catch it. So now here it says some did, but many others refused, citing shame and stigma that could result from being singled out as look at this, as a minority population. How is 75% white men a minority population? How are white men a minority population? Think about this. If LGBTQ people are a minority population, are people who date interracially a minority population? If people who dated interracially, so you got one black partner and you have one white partner, right? So the black partner would be a minority and the white person would still be a member of the majority, the population at large. But there's no classification for, quote, people that date interracially. So how does that work? Shout out to my man KO Kid Fit. What up with it, bro? The monkeypoxers were out strong. Be careful, man. Be careful. Be careful of those sheets. Somebody needs to warn the KKK. Shouts out to the KKK. The KKK is at the highest risk of monkeypox. They're proudly European and they stay covered in sheets all day. The KKK is proudly European and they stay covered in sheets all day. So they got a lot of risk factors. They're dealing with possibly infected bedding that they're wearing. I think if I'm not mistaken, they have all male meetings. And they're proudly European. They're really in touch with those European roots. You know what I'm saying? Huge factors. You know what I'm saying? We could be seeing a lot of spread at the rallies. You know what I mean? Those crosses that they burn warm the air. You guys know disease and germs replicate a lot faster when the air is warm. Those bed sheets. Yeah, they did trade them for the police uniforms. That's a fact. Oh man, shouts out to the Grand Dragons, you know what I'm saying? Because your ass is probably gonna be burning like one at some point. It'll be having flames coming right out of it. You know what I'm saying? That's hilarious. That is too funny. You know what I'm saying? So now here it says, while the U.S. government waited too long to sound the alarm, even as thousands died, the reluctance of some gay men to accept the facts of the virus spread also allowed the plague to grow faster. While monkeypox is not usually fatal, and like I said, again, we'll be talking about some fatal cases, it leads to an unsightly rash and fever. It has this much in common with HIV. Political correctness may have hastened its status as a global emergency. When a communicable disease arises, people deserve to know the facts, how it spread, and who is most likely to suffer from it. Shying away from the truth helps no one. As this article is saying that, it makes no mention of white men. As this article is saying everything about that, it's saying nothing about the white men that make up the majority of the cases. So somehow those white men are a minority, and they're not talking about a global minority. So that to me, that doesn't make any sense. That's double talk. It's nonsense. You know what I'm saying? Real quick, ladies and gentlemen, if you guys haven't smashed that like button, please make sure that you guys smash the like button. Also, if you're not subscribed to the channel, take a moment, go ahead and hit that bell icon twice. What we're going to talk about now are some deaths. The deaths. The angel of death, Azrael, has cometh. You know what I'm saying? In the form of some giant quarter-sized zits. Spain is reporting the second death from monkeypox. Somebody like underlay. You know what I'm saying? Mi culo caliente. Barcelona, Spain. Spain reported Saturday a second death in as many days from monkeypox. All right. There are believed to be first confirmed fatalities from the disease in Europe since its recent spread beyond Africa. Do they mean beyond the Denmark laboratory? And again, this isn't the same kind of monkeypox that was in Africa. People are getting the monkeypox in Africa from being bitten by rodents and vermin. People are getting monkeypox in Europe from getting pegged. They're getting monkeypox in Europe from getting pegged. Like that horse with the wings called Pegasus. You know what I'm saying? That's what's going on. So I don't know why we keep bringing up Africa. You know what I'm saying I don't think pegging is a common African practice. You know what I'm saying? Pegged is a lot different than a rodent bite. It's a hell of a lot different than a rodent bite. It's a hell of a lot different than a rodent bite. So now, check this out. We talked about the article that ABC had put out a couple days ago where they were talking about minorities, quote, bearing the brunt of monkeypox. But as we showed other information, especially that article from the Sacramento Bee, we saw that that's not true. Pegasus might be a name of the position in these orgies. Yeah, yoga. Probably a yoga position that looks like a damn what's the name of that game where you be on the floor with the red and blue dots? What's the name of that shit? They probably on the ground playing that. Naked. Oh, sweaty. Oh. What's the name of that damn game? Y'all know the game where you put that plastic thing down? Twister, yeah. Somewhere playing Twister with a damn slip and slide under it. You know what I'm saying? Ugh. God. They do that kind of shit and probably got jello shots all up and down the damn slide. Just nasty. You know what I'm saying? got jello shots all got jello shots all up and down the slide. It's nasty. Oh man. Yeah, I remember that motherfucker said you can get it from a towel. Like, come on, man, stop it. What kind of towel is you doing? A towel you rolled it all up and tried to tried to dry the whole entire inside of your anus all the way up to the small intestines and pulled it out and handed it to somebody else to use. I mean, damn. You know what I'm saying? Like, what? Oh shit. You know what I'm saying? That's sick. So now here it says the ministry based in Madrid said both fatalities were in young men. It was reported its first death on Friday, the same day that Brazil also reported its first death from monkeypox. So now here we got to give everybody the lesson about Africa again. The global monkeypox outbreak has seen more than 22,000 cases in nearly 80 countries since May. There have been 75 suspected deaths in Africa, not from pegging, mostly in Nigeria and Congo, not from pegging, where a more lethal form of monkeypox is spreading than in the West. And it's not spreading from pegging. And it's not killing people in the way that this is killing people. Ugh. So now here it says in the U.S. and Europe, the vast majority of monkeypox infections have happened in men who have sex with men. I mean, thank you for clarifying that, because that's not how Africans got the vast majority of their monkeypox. Like, the only reason why they put that stuff in there is so that white people reading this can be like, at least we don't have it as bad as they do in Africa. That's the only reason why they put it in there. But I bet you Africans is reading the news like, thank goodness we ain't out here pegging each other. See, when I would talk about how, like, most, Christianity isn't like a native religion. When I would talk about how Christianity isn't a native religion to most places, I would talk about the Druids, you know what I'm saying, and the Celtic people in Ireland and in Wales and Scotland. And I'll talk about how they were I'll talk about how they worshipped pagan how they worshipped pagan gods. You know what I'm saying? I guess some things never change. I guess some things never change, huh? You know what I'm saying? So I guess technically, if you actually sit down and think about it, these motherfuckers out here, these motherfuckers out here trying to be godlike. Just not Christian godlike. You know what I'm saying? The pun. Damn. Damn. Man, that's terrible. Man, that's terrible. The bacteria goes through the walls of the intestines into the bloodstream. Ugh. It absorbs. You know what I'm saying? Paganism. Yeah. Out here practicing paganism at them damn parties and shit. I bet you they're gonna start calling them parties the circuit church in a minute. You know what I'm saying? So look at this. Look at this. Here we go. This is what they were just talking about in that New York Times article. In the U.S. and Europe, the vast majority of monkeypox infections have happened in men who have sex with men, though health officials have stressed that anyone can catch the virus. The deaths outside Africa come 1 week after the World Health Organization declared the monkeypox outbreak a global health emergency. The notification of deaths due to monkeypox does not change our assessment, of the outbreak in Europe. We know that although the disease is self-limiting in most cases, monkeypox can cause severe complications, said Catherine Smallwood, senior emergency officer at WHO in Europe. Now, they would have somebody named Smallwood as the person in charge of monkeypox. You think that's a coincidence? You think that's a coincidence? They would have some motherfucker named Smallwood in charge of monkeypox. they be getting these names at, man? Straight out of Europe. You know what I'm saying? Somebody need to make a shirt that says straight out of Europe. You know what I'm saying? With the continued spread of monkeypox straight out of Europe, we will expect to see more deaths. That's not good. Our goal needs to be on interrupting transmission quickly in Europe and stopping this outbreak. How about a European travel ban? I mean, that really sounds like a great idea, in my opinion. If you guys think that a European travel ban is not a bad idea, give me a thumbs up. If you guys think that it is a bad idea, give me a thumbs down. And let me know why you don't think it's such a good idea. You know what I'm saying? So now here it says on Friday, Spain's health ministry reported 4,298 people were infected with the virus, making it the leading European country for monkeypox cases. So Spain, you know what I'm saying, is the leading European country for monkeypox cases. Now, let's play the game, shall we? You guys want to play the game? Let's play the everybody versus black people game. Spain is a country that's entirely, quote unquote, Hispanic, correct? So what does that do to the Hispanic numbers if Spain is the leading European leading European country for monkeypox? How does that work? What does that do to the Hispanic number? Because they can be brown when they want to, right? Well, I want them to be brown right now. So how that work? Anybody got the idea? Anybody know how that works? No, Hispanic means that your culture speaks Spanish. It means Spanish speaking. Most people that are, quote, mulatto, you talking about mestizos, they're Latino, which basically means a Spanish-derived group of people in Mexico, Central America, or South America. You know what I'm saying? See, that's another thing that a lot of people don't know is that Hispanic and Latino are two different things. Hispanic simply means Spanish speaking, or you can speak Portuguese and be considered Hispanic as well. You know what I'm saying? So now here it says of that total, some 3,500 cases were of men who had sex with men. Look at this. Look at this. Of that total, some 3,500 cases were of men who had sex with men. Only 64 of the cases were women. And I guarantee you those women were involved in relationships with men who they didn't know were freaks. Men out there getting busted down by some other man and then coming home busting their wife down. And she don't know it. You know what I'm saying? The ministry said 120 have needed hospitalization. So here we go with this Smallwood person. Smallwood said that around 8% of monkeypox cases in Europe have required hospitalization. Monkeypox, here we go. We go back to Africa again. Monkeypox has been endemic in parts of Africa for decades. Talk about the spread in Africa. Because, see, the problem with monkeypox that's going on right now is the spread. So that's what we should be talking about. If we're going to keep bringing up Africa, talk about the difference in the spread. Talk about how different a rodent bite is from getting pegged. Shout out to my man Crypto Key. What up with it, bro? They should call this a Pegasus virus. That's what they should call this shit, the Pegasus virus. You know what I'm saying? Real quick, ladies and gentlemen, we got 26 likes. Shouts out and thank you to everybody that's liked the video. And we got 19 live viewers. Shouts out to every single person that's watching. If everybody smashes that like button, ladies and gentlemen, we'll have 45 likes on our way to that 100. So please take a moment, smash that like button. Its leap to Europe and North America was linked by experts to two raves. Look at this, see? Two raves in Belgium and Spain. Raves. See? I told you guys. European sex parties are like no other. All kinds of shit going on. You know what I'm saying? Partying so hard you come back with spots. Like, that's crazy. Spanish health authorities are administering 5,300 vaccines that Spain received from the joint EU vaccine purchase scheme. Health workers say that it's far fewer than the number needed to cover the at-risk groups. But the rush to buy limited vaccines by richer Western countries is putting Africa in danger of being left out. I don't think they're really worried about it all like that. You know what I'm saying? What they talking about Africa being left out? Africa been dealing with this shit. It's endemic in Africa. Talking about Africans being left out. I'm talking about that's exactly what they need to do is leave Africa out of these conversations. I always want to include us when they got some shit going on. Like, can't have degeneracy on your own. You gotta somehow blackwash it, as they like to say. Monkeypox spreads mainly through skin-to-skin contact, but it can also be transmitted through bed sheets. Here we go with the KKK shit. Used by someone with monkeypox. Be careful. Make sure you use bleach. Don't do like Donald Trump said, or don't drink it. Wash your sheets with it before you go to a Klan rally. Shouts out to Robin. What up with it? Be careful with them deadly sheets. Sheets out here killing people. I'm going to go to work tonight, and I'm going to tell them I want a Post-it note instead of a, quote, sheet of paper because I don't want to get monkeypox. Symptoms include fever, body aches, chills, fatigue, and hives. The illness has been relatively mild in many men. See, I told you. Many men. But people can be contagious for weeks, and the lesions can be extremely painful. That's what I heard. They have all kinds of people all over the place making videos, standing up about how painful those lesions are. You know what I'm saying? Pay very close attention. Most of them videos and people ain't sitting down. They standing up. Look at that. This is back in July 1st. This is when they wasn't talking about it all like that. New monkeypox cases have tripled in Europe since June 15th, the WHO regional chief says. They've tripled. What do you guys think about that? New monkeypox cases have tripled in Europe. See that? Oh. Look, you should have said, shut your ass up. Oh, my bad. You can't. It's probably sore. So now here it says monkeypox is continuously reaching new parts of Europe, where the number of new cases has tripled since June 15th to more than 4,500 laboratory confirmed cases. The World Health Organization's regional director for Europe, Dr. Hans Kluge, said in a statement on Friday, look at this, Europe accounts for nearly 90% of all confirmed and reported cases worldwide since mid-May, Kluge said, adding that 31 countries and areas in the region have now reported at least one monkeypox case. I bet you they making all kind of music They probably got a whole monkeypox band where they make different sounds. Farts coming out sounding like whistles. One of them sound like a saxophone. The other one sound like a tuba. You know what I'm saying? One of them sound like a clarinet. Somebody big ass. It's probably some big motherfucker that got monkeypox, about 350 pounds. He like bum 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 bum. Sounding like the Jersey Boys and shit. That barbershop quartet shit. Bum 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 bum. Ooh. Ooh. We got the monkeypox. We got the monkey. Remember that TV show called The Monkeys? Remember they had that TV show called The Monkeys? Shooby doo wop. Them zits be like shooby doo pop. Doo. Shooby dooby doo pop. Now here it says the UK reported more than 1,000 monkeypox cases, the most in Europe, followed by Germany and Spain and Portugal, France, according to the latest joint bulletin from the European Center for Disease Prevention and Control and the WHO's regional office in Europe. Now, of course, we got to, I don't know why we up here got to compare it to Africa. The numbers are smaller in Africa. I mean, why wouldn't they be? Oh, trust me, they ain't got to worry about that. They ain't got to worry about that. I self-quarantine and I'm still social distancing from C19. You know what I'm saying? On Monday, the Africa Centers for Disease Control and Prevention reported that since the start of 2022, 1,715 cases, including 1,636 suspected cases of monkeypox, had been reported in 10 countries. The figures include 73 deaths. So now this paragraph here is only inserted into this article to talk about these deaths, to make it look like Africa is doing worse than Europe when it comes to monkeypox, and they're not. They're not. No deaths has been reported in the disease in Europe, Kluge said. So again, see, I mean that's proof. I told you guys. The reason for this paragraph is to comfort white people, so they can say, "Oh my God, you know, in Africa, I mean, it's not. Oh my God, in Africa they're dying. I mean, oh my God, it's 73 deaths. Thank goodness none of us have died from it. I mean, that'd be just horrible if we were dealing with how that shit is. You already know. I don't have to go through the motions. You guys know how it is. What we have to do is we have to take a problem that we have in our community and try to put the magnifying glass on it in somebody else's community and say, oh my God, thank goodness we're not dealing with that. You are dealing with that, dummy. You're dealing with exactly that. I'm going to say, we're not dealing with it. You are dealing with it. While men still account for the most reported infections in Europe, Kluge said, small numbers of cases have also now been reported among household members, heterosexual contacts, and non-sexual contacts, as well as among children. And again, anytime it comes up in children, in my opinion, it needs to be an automatic CPS investigation. Yeah, they want black people to be the face of it bad. They want it bad. They want black people to become the face of this bad. So Kluge provided detail on who's getting the disease in Europe. 99% of the cases so far were detected in men. This is stuff we already know. The majority are men who have sex with men among patients whose sexual orientation is known. Most cases were people who are between 21 and 40 years old. Only one patient was admitted to intensive care in Europe, Kluge said. So because of that, they can rest easy because they don't have it as bad as those Africans. That's all this is about. As long as they can sit there and say, well, at least we don't have it as bad as those people, that's all it's about. In their minds, that's this being controlled. That's this being under control. Just simply them not having it as badly as Africans, or them creating a false perception to where they feel they don't have it as bad as Africans. That's all that matters to them. Real quick, ladies and gentlemen, we got 19 people watching and we got 26 likes. Again, shout out to everybody that liked and shout out to everybody that watched, that's watching. If everybody smashes that like button, we'll have 45 likes, which would be great. So please help us out with those likes. Get us to that 45. That'd be awesome. So now here it says only one patient was admitted to intensive care in Europe. The vast majority of cases have presented with a rash, she said, and about 3/4 have reported systemic symptoms such as a fever, fatigue, muscle pain, vomiting, diarrhea, chill, sore throat, or headache. Kluge said governments in the region must step up their surveillance efforts from testing and contact tracing to sequencing. That's the end of that article. So now my thing is what we're doing now is we're running into things that we already know. You know what I'm saying? We're running into a bunch of stuff that we already know. Now, a report came out from the CDC. Okay. A report came out from the CDC that goes over some trends. Okay. But before we go over that chart with the trends, I want to show you guys this thing from California Department of Health. Okay. So this is from the California Department of Public Health. All right. Division of Communicable Disease Control, monkeypox. So they have a data table here. And as you guys can see, this is all fairly recent. It's from July 28th of 2022. Okay. The current monkeypox situation is rapidly evolving, and the information below will be updated as soon as new information emerges. All right. Now, here it says the risk of monkeypox to the public is currently very low based on the information available. So now my question is, why in San Francisco is it a public emergency if the disease, or if the Division of Communicable Disease Control is saying that? Does that make any sense? If that makes sense, guys, give me a thumbs up. If it doesn't make any sense, give me a thumbs down. Does that make any sense? The current monkeypox situation is rapidly evolving, and the information below will be updated as new information emerges. CDPH is closely monitoring monkeypox transmission in the U.S. and California to ensure rapid identification of cases. The risk of monkeypox to the public is currently very low based on the information available. While monkeypox can infect anyone, here we go. Many of the recent cases in 2022 have occurred among persons self-identifying as men who have sex with men. I mean, I don't understand why they keep doing this. Why do they keep saying that as like a disclaimer? Well, it can happen to anybody. Like, we know it can happen to anybody. But the group that's primarily being affected is the LGBTQ element of the group. So why do we keep saying that? So what I want to show you guys down here, the most important thing, race and ethnicity. There you go. And this is why they keep bringing up Africa. Well, I mean, people are dying in Africa. I mean, this is what they do. Instead of reporting the disease in an accurate way so that everybody dealing with monkeypox at the current moment can be protected or have good preventative measures in place, this is what they want to do. I mean, like, you can't make it up. You know what I'm saying? You cannot make this up. So there's that. All right, that's that right there. That's the most important thing. We could look at sexual orientation. Look at this. Look at these numbers right here. You guys see these particular groups that I'm highlighting. Now, what I need you guys to do in the comment section is I need everybody that's watching right now to tell me in the comment section, what do they notice about what I've highlighted here? What do you guys notice about what I've highlighted here? So we know about monkeypox, we know about the symptoms, we know about the transmission, but what I want you guys to find and take note of is this: monkeypox spread primarily through direct contact with infectious sores, scabs, body fluids, including during sex. As well as activities like kissing, hugging, massaging, and cuddling. Monkeypox can be spread through sexual intimate contact, including kissing. So now let's see what they talk about with prevention. Shouts out to my man Mike Mellis John. What up with it, bro? Let's see what they talk about when it comes to prevention. What do you guys think the number one method of prevention should be on here? Right, kissing 10 people in a month, a little bit excessive. You know what I'm saying? There are numbers of ways to prevent the spread of monkeypox, including always talking to your sexual partners about any recent illness and being aware of new or unexplained sores or rashes on your body or partner's body, including on the genitals and anus. Yeah, you'd have some serious explaining to do. The hell is that? I wonder if anytime anybody sees new genitals or any new lesions on somebody's genitals or anus, do they ever say, you're gonna need to put your pants back on? Do you think that ever happens? How often do you guys think that happens? You're going to need to get fully dressed until you can explain that. Avoiding close contact, including sex. There we go. To me, this could quite possibly be number one. Practicing good hand hygiene. People who become infected should isolate until their symptoms are improving or have gone away completely. Rash should always be well covered until completely healed. Using appropriate personal protective equipment like a mask, gown, and gloves when caring for other people with symptoms. Would personal protective equipment include a condom, ladies and gentlemen? In this situation for monkeypox that we're talking about, would personal protective equipment include a condom? I think it's safe to say, yeah, a condom should definitely be included in that. If you guys agree, give me a thumbs up. If you guys disagree, give me a thumbs down. A full body condom. Facts, Carla. It should include an NBC suit. So now we know all of this other stuff. So I don't even know why we're comparing monkeypox and C19. They're two completely different diseases. Completely different. You know what I'm saying? I don't know why they do stuff like that. You know what I'm saying? Like that. I don't know. So this is the report that the World Health Organization put out on the 28th. Monkeypox global trends. Okay. The ongoing outbreak of monkeypox continues to primarily affect men who have sex with men who have reported recent sex with one or multiple partners. So there's that. So now, this is the global situation update. And I think what I'll do is I'll actually read this entire report in another video, but I want to just show you guys some things. Okay. Are you guys able to see this graph down here? Epidemic cases shown for cases reported up to July 25th of 2022. Now, do you guys see European region? European region is this pink color here. Look at the European region. Now, blue is America. Look at Europe, look at America. It's not hard to see that Europe and America make up the majority. You know what I'm saying? Look at this. Monkeypox reporting completedness. Total confirmed cases, total detailed confirmed cases, percentage detailed cases reported. Look at this. European regions, 13,043. Regions of America, 377. I'm sorry, 3,772. African region is only 328. Why do they keep bringing up Africa? I want you guys to pay very close attention to this graph. Do you guys see this? Why do they keep bringing up Africa? Well, they getting it over in Africa too. European region, 13,000. African region, 328,000. Or I'm sorry, 328. And Europe is a first world country. So they have no excuse to have this number that is ballooning third world, entire continent of Africa. Now, what do you guys think about that? What do you guys think about that? These case profiles. MSM, 98.3%. Now, notice they decided not to do racial comparisons. Any other time they would compare race. There's no racial comparisons here. None. And we'll see that when I do the streams about talking about this. So now my question is, what do you guys think about that? How do you guys feel about that? I think that we have proven our case. But you know what we got to do? They never rest. So we got to keep driving it home. So with that being said, ladies and gentlemen, that is the end of the stream. If you guys are not subscribed to the channel, you guys know what to do. Make sure you smash that like button, share the video out to all of your followers. Take a moment, make sure that you're subscribed to the backup channels as well as my other social media. If you want to get information to me quickly, hit that Patreon link in the chat. Patreon membership is only $5.99. It helps to build the channel towards independence, which is something that I am trying to do. And I will catch you all on the next video. All right? Peace.